Bismillahirrahmanirrahim. My name is Muhammad Bilal and I have done PhD in pharmacology, but my research topic was evaluation of therapeutic efficacy of hijama in the treatment of various disorders. So that is why I shifted from teaching pharmacology to the students of PharmD, University of Karachi, to performing hijama and establishing the research institute by the name of Bilal Hijama Clinic, and later on it converted to fully functional clinic, and I shifted my career from teaching to hijama therapy. And since my research was based on the scientific evidence, and I have conducted the research on various types of patients who are suffering from multiple conditions. Some of them were suffering from metabolic disorders, some of them were suffering from pain problems, and even for chronic renal failure patients I have performed hijama for a long period of time, such as around 3 years, and I continuously performed hijama on those patients. That was a selected group of patients who were maintained on dialysis because their kidneys were not functioning normally. So I witnessed a lot of improvement in their case, and I published a research paper which concluded all of the findings during that research, and that paper is published and available on PubMed by the name of Hijama Improves Overall Quality of Life of Patients of Chronic Renal Failure. So that's how I started my career in hijama therapy, and then I started teaching hijama course as well from 2014, and up till now I have conducted around 12 courses of hijama, and in those courses I targeted those areas in which the hijama therapists at that time were weak, and still they are suffering, they are facing some problems. And these areas are knowledge of anatomy and physiology, pathology, and the treatment protocol, the procedure, maintenance of hygiene during the procedure and after the procedure, and the treatment plan, how to formulate a treatment plan which is specific to the condition of the patient. So that's how I developed my course. And as I have already told that I have been teaching before I started my career in hijama therapy. I was a teacher, a lecturer in University of Karachi in the Department of Pharmacology, Faculty of Pharmacy, and before that I was teaching the same subject in Jinnah Medical and Dental College in Karachi. And later on also, when my research was continued, whenever I got an opportunity to teach as a visiting faculty, I joined multiple times, and I taught in University of Karachi again also. And then when I started teaching hijama to the students of hijama, the hijama therapists, from 2014, I have been conducting this course since then, and now I am starting a new course which is for those students who are new in this field, and this is basic hijama course. And today I will share the course outline of this course, that what I will conduct, what I will teach in this course, inshallah. The first part will be introduction of hijama, which will include the origin of hijama, its history, its various mechanisms of hijama, how hijama works, the different theories which were proposed, that how hijama works, and the ancient methods versus the modern methods, the ancient equipment versus the modern equipment, and the legal status of hijama in Pakistan and in overall all over the world, what is the legal status. So these kinds of things will be covered in the topic of introduction to hijama. And then the basic anatomy, the second topic will be basic anatomy related to hijama. In this part, I will be covering not only just the anatomy but the physiology and pathology also, and we will cover certain topics more in depth as compared to other topics. For example, the topic of blood will be covered in great detail because we deal with blood during the hijama, so we should know all about blood, whatever we can learn, that how blood is formed in our body, in what quantity it is present, how it circulates in the body, what are the veins and arteries and capillaries, what is the function of heart, what is the structure of heart, and how its structure helps in its function. So what are white blood cells, what is our lines of defense, what are the lines of defense and defense mechanism which are working continuously in our body without our knowledge. And then the related to the topic of skin, we will also go into detail, because skin is that part of the body which we are touching during the procedure, the hijama procedure. So we will be covering the topic of skin in detail, and that topic will be covered inshallah along with all of its details. For example, the layers of skin, how many layers of skin are there, and epidermis, dermis and hypodermis, and what are the sub layers of epidermis, and up to what depth we are going during the procedure of hijama, which layers are being cut through hijama, and how we should make sure that our cut is not too deep and it's also not too shallow, and it should be up to the appropriate depth, so that the appropriate amount of blood and the targeted quality of blood comes out, and not the fresh blood. So that's how we will discuss in detail structures of skin, the different layers of skin. All of those structures will be discussed inshallah in detail. So in basic anatomy and physiology part, first topic will be blood, the second will be skin, and the third will be musculoskeletal system, because we know that musculoskeletal system includes all of the muscles and bones and joints, tendons, ligaments, bursa, these kinds of structures which are very essential for performing the daily activities of our life. And whenever a patient comes to us with a certain condition of musculoskeletal system, for example, take an example of synovial joint, which is the most commonly occurring problem in Pakistan, and I think that in other parts of the world also. The patients are suffering from pain in their knee joints, or sometimes they are suffering pain from which is starting from lower back and radiating to the feet, and sometimes the causative factor is a nerve, sometimes the causative factor is a muscle spasm. And what are these conditions, that muscular spasms or disc bulge or disc herniation or loss of lumbar lordosis or loss of cervical curvature? All of these topics will be covered in the topic of musculoskeletal system. What is bursa, what is bursitis, what is tennis elbow, what is the Achilles tendonitis, what is the plantar fasciitis. So these kinds of topics will be discussed in the main topic of musculoskeletal system, the anatomy and physiology related to the musculoskeletal system. So these parts, that is anatomy and physiology parts, in these parts we will cover the basic anatomy and physiology, and also we will cover the basic pathology. For example, when we will be talking about certain conditions, we will also discuss about the lab reports of the patient, because when we are going to treat a patient, we should know about the condition of the patient, that is how, for example, how much is the quantity of blood is there, I mean the level of hemoglobin, what is the hemoglobin level of the patient, is he anemic, is the hemoglobin level below 7 or below 8, and then should we perform hijama or not, what are the platelet counts, and if they are too low, what is the lowest limit, after that we should not perform hijama on certain patient. So these kinds of things we will discuss in the pathology part, and we will also discuss in the pathology part the biochemical reports, for example biochemistry reports, such as the for example serum creatinine level, its significance, and related to hijama specifically, or lipid profile, different types of the lipids which are represented there, and uric acid, and such as the how to diagnose osteoarthritis, and how to differentiate between osteoarthritis and rheumatoid arthritis, what are the different types of tests which are performed to diagnose these two conditions separately, and these kinds of things inshallah. And also we will also cover the radiology part, that that is to read the reports of x-rays or MRIs or CT scans. Inshallah we will cover all of those things also in the part of pathology, the basic pathology, because the basic pathology is very much important to diagnose the condition of the patient correctly, and the more accurate the diagnosis is, the more accurate and targeted will be the treatment plan. So this will benefit the patient. The patient will benefit from our knowledge of his condition. And then we will cover in detail an aspect which is very important for the prevention of the diseases, and the transmission of diseases, for preventing the transmission of diseases from the patients to the staff, from the staff to the patient, and from one patient to another patient, and from our clinic to the environment. So all of these safety measures, the safety precautions, they are covered in the topic of hygiene for hijama, because we are dealing with blood in hijama, so we should be very much careful about our hygienic practices, hygiene protocol, and how to form the protocol, how to avoid all of those loopholes which can cause spread of infections through our procedure. So in this regard we will cover the matters of personal hygiene, the matters of the clinical hygiene, the dress codes, we will cover the topic of air filtration, we will cover the topic of instruments sterilization, and the cleaning, the daily mopping and cleaning of all of the furniture and floor and walls and doors, everything which is included in the clinic. And lastly, but not the least, which is the very important aspect of hygiene, that is the proper disposal of the waste, and that is through the process of incineration. What is incineration, how it is performed, who performs it, who can perform it, and how should we dispose our waste, the biohazardous waste, responsibly, so that it is not harmful for the society. So all of these topics inshallah we will cover in the topic of hygiene and hijama. And then we will discuss the importance of certain points which are termed as sunnah points. What is the importance of sunnah points, why they are termed so, and important days and dates for hijama. Are there any specific days or dates based on the ahadith and sayings of the Prophet sallallahu alaihi wasallam? So if there are any specific dates or days which are mentioned in ahadith, what is their significance, what is the significance, and how should we perform hijama accordingly. And we will explain the locations of the sunnah points also, what are the sunnah points. And then another special topic which we will cover in this course will be hijama for spiritual problems, because we know that hijama is a prophetic medicine, is part of the prophetic medicine. So the knowledge of hijama has come from Allah subhanahu wa ta'ala, the creator, God. So he knows very well about our needs, and when this procedure of hijama, this mode of treatment was given to us, we were blessed with this mode of treatment on the occasion of Isra or Miraj, the night of journey, when the Prophet sallallahu alaihi wasallam went to meet his creator over the seven heavens, and with the along with Jibril, he traveled, and then at that point during the meeting he was given the gift of salat, which we termed as prayer, and then the other gift which was also given in the same travel, that was hijama. And what is the proof of that hijama was given as a gift to the Prophet sallallahu alaihi wasallam? Inshallah we will discuss in detail. So hijama works not only for the physical problems and the mental problems and the psychological problems, but it also helps in our spiritual problems, and we have seen many benefits related to the spiritual well-being of the patients, and the patients have who had been suffering from a lot of spiritual problems, they benefited from hijama greatly. So what is the procedure for performing hijama for spiritual problems? What are the precautions needed? What is the mode of treatment? How the procedure is carried on? Inshallah we will discuss all of these details during our topic of hijama for spiritual problems. And then lastly we will discuss the hijama points for various diseases, and we will discuss specific diseases in this case, and I will give a brief introduction of all of these aspects. I have briefly explained the overview, briefly explained the course, but now I will go into a little bit detail of each of the section, and then I will let you know inshallah that what we are going to cover in this course. So the first part, that is the introduction of hijama. In this part we will cover the history of hijama, the ancient mode of treatment of hijama, the ancient equipments or tools which were used during that time, during the prehistoric era or the historic era, and the Sunnah way of doing hijama, the method which the Sahaba adopted and in the time of Prophet sallallahu alaihi wasallam. Inshallah we will discuss all of these things, and we will discuss the theories of hijama, that how hijama works, what is the mechanism of action of hijama, and these things will be discussed in the topic of introduction to hijama. We will also discuss the current trend of hijama, that how hijama is getting popular day by day in all over the world, and not only just in Pakistan and Islamic countries, but it is also spreading at a I will not say alarming rate because it's not alarming, it's a blessing. It's a blessing from Allah subhanahu wa ta'ala to the suffering humanity, and hijama is trending throughout the world, and in most of the countries of the world, modern countries of the world, hijama is spreading, and it is spreading because of its efficacy and its safety, because hijama is a safe procedure, it's a natural way of treatment, it does not include any kind of side effects and adverse effects, rather I would say it does not include any kind of adverse effects, rather it has some side positive effects, not the negative effects but the positive effects. For example, a person goes through hijama for a condition such as neck pain, but he also gets relief from stress or anxiety or muscular spasm of the neck, or the sleep problem like insomnia. So all of these things are covered in 2 to 3 points, 2 to 3 sides of hijama, which are located on the back of the neck and around the shoulders. So I am just giving an example. So that is how hijama is helping a lot, and it does not include much cost. So that is why we have been seeing the increasing trend day by day of hijama. And then the significance of hijama in this era, when there are a lot of infectious diseases spreading throughout the world, pandemics are going on, and viral infections for which vaccines are still undergoing, the procedures, the procedure of test period, I would say that the trial phases are going on, and the trials are being conducted on the patients, because there is a kind of situation of emergency. So that is why the proper time which would have been taken by establishing those vaccines is not being taken by the companies. So in a hurry, or because the humanity is suffering a lot, so they have speeded up their efforts, and without completing the safety protocols, the vaccines are being made, and they have been in use. They have been in use since 2 years. So in this condition of chaos and the suffering humanity, we are seeing that hijama is helping a lot. Most of the patients who had been previously suffering from the symptoms of viral infections or the complications of the drugs or the vaccines used to treat those conditions, they caused a lot of severe side effects, and we are seeing that hijama is helping a lot in alleviating those problems. So significance of hijama increases in this era specifically. And then we will explain in the part of introduction, we will explain the legal status of hijama in Pakistan, who can perform hijama legally, and what degree is required to perform hijama, what courses are authorized by the government, and what is the legal status of hijama. So these things will be covered in the part of introduction, and what is the procedure of obtaining a license to perform hijama legally. All of these aspects, legal aspects, will be covered in the part of introduction. Now I will cover the section of basic anatomy. What we will cover in the part of basic anatomy, we will cover the basic anatomical terminologies which are used to express a human body, which are used to mark a specific part of the body, how to how to translate the medical language to the common person's common English. So we will explain all of the basic anatomical terms in the layman's language, that how to understand all of these terms, and then we will discuss the different systems of the body, and specifically the cardiovascular system, because as I have explained earlier, that we are dealing with blood in hijama, so that is why we should know everything, whatever possible related to blood and the cardiovascular system both, that is the structure and the anatomy and physiology of heart, and the blood vessels, the types of blood vessels, all of these things, the types of blood cells, plasma, serum, all of these things will be covered in the part of basic anatomy and physiology of cardiovascular system. And then the muscular system will be discussed, because when we are dealing with the conditions of muscular spasms and pains, in those conditions it is very essential for us to know the names and the locations of the important muscles which are commonly affected, and the patients are suffering from pain problems due to the muscular spasms of certain areas of the body. So that is why we should know that what are the names and their locations and their attachments, to which bones they are attached. So we will cover all of the important, the significant muscles, specifically the superficial muscles of the body, because we are directly dealing with the superficial muscles through hijama. We are not dissecting a body, we are not going deep inside a body, we are not even incising or cutting the whole skin, all layers of the skin, and we are not reaching up to the level of muscles, but still we should know what is the surface anatomy of the body and what are the superficial muscles. And then we will discuss in detail the skin anatomy, because skin is that part of the body which we are directly dealing with, and we are making scratches or incisions of hijama on the skin. So what is the anatomy of skin, how skin is formed, how many layers are there in skin, and at what level of layer we are working in hijama, what is epidermis, dermis, hypodermis, and what are their depths, how should we know that we have not gone too deep, and what are the signs and symptoms to make an appropriate incision, which is barely a scratch. So how can we make sure that our scratch is not too deep, and it is also not too shallow as well, because if it is too shallow, then there will be no bleeding and our process of hijama will not be completed. So that is why inshallah we will go into the details of the anatomy of the skin. And then the musculoskeletal system, we will also cover the skeletal system, because the musculoskeletal system problems are very common, for which patients are coming to us for hijama. For example, osteoarthritis or the Baker's cyst, or frozen shoulder, or cervical spasms, cervical spondylosis, or sciatica, low back pain, pseudosciatica, plantar fasciitis, bursitis, tennis elbow. These all of these conditions are related to the musculoskeletal system of the body. So that is why we should know all of these things. We should know the names of these structures, their functions, what are, for example, what are the types of joints, what are the synovial joints, what is synovial membrane, what is synovial fluid, what is the difference between ligaments and tendons. So such kind of things are covered in the part of anatomy of musculoskeletal system. Then we will discuss the central and peripheral nervous system, because it is also very important to know for performing hijama, because the reason is that sometimes we are targeting the organs through the peripheral nerves, because we are not going deep inside the body. We are not directly touching the liver or kidney or the stomach or heart, but we are performing hijama on the skin. So the peripheral nerves, which are superficial nerves, which are supplying all of these organs, the internal organs, the nerve supply, the afferent and efferent nerves are going to each and every organ, and the sensory and the motor nerves are performing the important functions of maintaining the function of these organs. So we are targeting these nerves to attempt or to affect these organs in a positive way. So that is why we should know exactly what are the locations of these nerves, where they are located, and how we can access through them the internal organs. And another aspect is that sometimes there are some neuronal problems. For example, the problem of sciatica is a neuronal problem. I mean, it is the longest axon or the longest neuron of our body, the sciatic nerve, which is coming out of the L4 and L5, which is coming out from the hole which is present between the L4 and L5 vertebrae of the lumbar region. So for example, the nerve which is coming out of L4, L5 or L5, S1, all of these nerves of the lumbar region they accumulate and make a bunch in around the hips, upper hips, and this bunch is called the lumbar plexus. And then these nerves they travel throughout the length of the leg up to the toe, and they are passing from different parts of the leg. For example, the nerve which is originating from the L4, L5 region is going from behind the neck, from behind the leg throughout the length of the leg. This nerve is going from the behind, while the nerve originating from the L5, S1 vertebrae is arising from the side of the leg. I mean, it initiates from the L5, S1 vertebrae, and then it goes to the lateral side of the leg, the outer side of the leg, and then it goes right up to the smallest finger of the foot, and it is going from the side. So how to diagnose without an MRI? If the patient does not have an MRI, how will you diagnose that which nerve is being affected and at which vertebral level the problem is there? So inshallah we will cover all of these things in our topic of central and peripheral nervous system. In the central and peripheral nervous system, we will also cover the autonomic nervous system, the functioning of autonomic nervous system, the sympathetic and parasympathetic nervous system, and in the part of central nervous system we will cover the different areas of brain which are performing the function of the body, and they are performing very important functions of our body. So we will cover all of these things in the part of nervous system. So this is one aspect. And then the cardiovascular system, the anatomy and physiology of the cardiovascular system will be discussed in detail. Structure of heart, how many chambers are there, what is the difference between the upper chambers and lower chambers, and the right side and the left side, what are their names, and what are the veins and the arteries which are originating from the heart, and they are carrying which type of blood, what is the circulatory circuits, what is the systemic circulation, what is the pulmonary circulation, and all of these aspects will be covered in the part of cardiovascular system. And then after in the cardiovascular system part we will also cover the details of blood, the composition of blood, that what are the cellular parts of the blood, what is the liquid part of the blood, and what is the difference between plasma and serum, and all of these types of aspects related to blood, like hemoglobin level, and what is the anemia, what are the types of anemia, and what are the malnutritions which are responsible for causing anemia. All of these aspects will be covered inshallah in the part of blood and the cardiovascular system. And then we will also cover the physiology of all of these systems which I have already discussed, that for example the physiology related to the skin, what are the different layers of the skin, and what are the structures which are present inside those layers, and how through hijama the function of the skin improves, and what functions skin performs itself, such as the thermal regulation or the sweat production or the heat insulation. All of these functions will be discussed in the part of skin physiology and anatomy. And then we will also discuss the physiology of cardiovascular system, the function of heart and the function of capillaries, the function of RBCs, the function of hemoglobin, and we will also discuss the function of brain and spinal cord, and the cranial nerves. We will also discuss those nerves which originate from brain. We will also cover the spinal nerves, and we will also cover the cranial nerves which are originating from the brain. And then we will also discuss the basic physiology of digestive system, anatomy and physiology both. We will cover almost in all of the systems anatomy and physiology combined, and then we will move on to the next system. And in the same way we will also cover the endocrine system, how many glands are there in our body and which hormones they are secreting, what are the functions of those hormones. And then we will discuss the musculoskeletal system, and I have already explained that why it is very important for us to know the details of musculoskeletal system, because sometimes patients are suffering from specific some pains in specific areas of their body, and they are coming to us with their MRI reports or CT scans. So we have to assess those reports, we have to analyze those reports, and we have to make a diagnosis that which part of the body is affected and how should we treat the problem. For example, if a person who is suffering from cervical pain is also suffering from vertigo, and we see that he is also suffering from muscular spasm of the trapezius muscle. Now what is trapezius muscle, what is the location, and how should we treat it, how the muscle will be relaxed, how the blood circulation will impact the spasticity and the stiffness of the muscle will be relieved. So this knowledge will be helpful a lot in treating all of these conditions. Diagnosis plus the treatment inshallah will be improved a lot with this knowledge. Then we will also discuss the physiology of endocrine system, that which hormones the major glands are secreting and what functions those hormones are performing in order to maintain the balance of the body. Then we will also discuss the basic pathology, the basic pathological terms, that for such as what is inflammation, what is necrosis, what is apoptosis, and what is the pathophysiology, how the pathogenesis goes on, how a disease originates, how it spreads, and how can we identify a disease through the lab reports, how should we assess the basic biochemistry reports such as CBC or HbA1c or lipid profile or LFT or renal profile, urea, creatinine, electrolytes. So these things are discussed in the part of pathology. We will discuss the pathological lab reports, how to analyze them and how to make decisions based on the reports, and this is also termed as objective data in the field of diagnosis. The information which we obtain through the lab reports is termed as objective data, while the information which is obtained by the patient, for example, the patient tells the history of his disease, those informations are termed as subjective data. So the combination of subjective and objective data leads to a correct diagnosis and a correct prognosis, and the target is accurate for the treatment purpose. So this aspect inshallah we will cover in the basic pathology part. And also in the basic pathology part we will also cover the radiology, such as the assessment of MRI scans, films, CT scans, their reports, X-rays, ultrasounds. We will also discuss all of these aspects inshallah in the pathology part. And then another very important topic which is related to the hygiene of hijama. Inshallah we will cover the hygiene of hijama in detail, because this aspect is the most important aspect in performing hijama. Since the blood which we are dealing with, it is the source of contamination. Most of the time the germs are residing inside the blood, and whenever we are taking out that blood from the body, then it becomes a threat to the environment, to the person who is exposed. And for example, the person who is exposed to that blood is first of all the patient himself, and then the therapist who is performing hijama on that person. And then later on when this waste is disposed of, the environment is exposed to that threat. So that is why we should take every type of precaution, starting right from the entry of the patient into the cabin and up to the exit of the patient from the cabin, and then the waste disposal. So what are the hygiene protocols? How should we avoid infecting the patient, and how should we avoid ourselves from being infected by the patient? These practices will be discussed in detail, which will include sterilization procedures, the mopping and cleaning practices of the clinic, the environment, how to filter the air, what are the different ways of achieving this target, how to maintain the cleanliness and the sterilization of the procedural area, the operational area of for hijama, and how to properly sterilize the instruments through autoclave and the chemical sterilization, and then lastly the incineration of biohazardous waste, and it is our ethical responsibility to dispose of the waste such as it does not harm the society. So that is why the proper way of disposing of is incineration. What is incineration, how it is conducted, where it is conducted, who is responsible for doing it, who is authorized to perform incineration procedure. All of these aspects will be covered in the topic of hygiene for hijama. Personal hygiene is also discussed in this regard, because if our own hygiene is not up to the mark, then we are ourselves are not presenting ourselves first of all in a pleasant way to the patient, and we are also becoming a source of contamination for the patient. Then the importance of dress, why the uniform should be worn by the staff, what is the importance of wearing separate clothes for the procedure of hijama, and wearing separate shoes also, and what is their importance. We will discuss these topics in detail inshallah in this part of hygiene and hijama. So these are the most important aspects related to the hygiene. And then we will discuss the procedure of hijama itself. the main topic of our course, that is the procedure of hijama. So in this regard, we make sure the safety first, and then we go towards the efficacy, because if the safety is not there, if the procedure is not safe for the patient or for the therapist, then the whole procedure becomes pointless. So that is why we make sure that the environment, the procedural area, the operational area is clean, and we are taking precautions at every step. Like the patient enters the cabin, he will lie down. So on what type of bed will he lie down? What is the shield which is present there, which will make sure that the patient will not get any type of bacteria from the bed. And then later on, before starting the procedure, how to cleanse, how to sterilize that area of the body where we are going to perform hijama, and then how to perform hijama, how to put cups on specific points of the body, how to select the points according to the disease, and then how to perform dry cupping, and then the procedure of incisions, and then the procedure of making suction again, and then for how long should we wait so that the appropriate amount of blood is collected in the cup. How will we know that now it is the right time to remove the cup and the blood has stopped coming out, and then how to clean the wound, and then how to perform the dressing on the wound. So these are the steps of procedure. And then the post operative care, the tips which are mentioned to the patient, that how will he take care of his wounds afterwards in the home, and how will he and when will he come back for the follow up visit, and what time interval should be there between one visit and the second visit. All of these aspects will be covered in the part of procedure of hijama. Then we will discuss the Sunnah points. What are the Sunnah points, what are their locations and their names, and the reason behind calling it Sunnah point. What are the Sunnah dates, what are the ahadith for them, and the days which are better for hijama, and the days which are not good, what not supposed to be good for hijama, and what is the authenticity, what is the proof behind all of these things, what is like the Sunnah points or dates and dates of hijama, the best time to perform hijama. These things will be covered inshallah in the topic of procedure. And then we will cover the topic of hijama for spiritual problems, because I have already told you that hijama is not just a physical way of treatment, it is also a mental way of treatment, a spiritual way of treatment, psychological way of treatment, and all of the conditions related to any area of the life are improved through hijama. So how to perform hijama for specific spiritual problems, we will cover the precautions and the procedure, and we will also introduce you to ruqya sharia. What is ruqya, what are the characteristics of a raqi, who is a raqi, and how hijama practitioner can become a raqi, or how can he perform ruqya along with hijama to treat the spiritual problem. Inshallah we will discuss this part. And then hijama for various diseases, and we will discuss the hijama points for certain conditions, and we will discuss some certain specific conditions which will not be more than maybe 10 or 12, but these will be the most commonly occurring complaints for which the patients visit hijama clinics, and it will include sciatica, it will include migraine, it will include cervical spondylosis, it will include hair fall, and we will also cover obesity and the problems of knee pain or osteoarthritis, and we will also cover the problems related to infertility, male infertility problems or female infertility problems. All of these aspects will be covered inshallah during our orientation, during our class, this course, which is hijama, basic hijama course, and the total duration of this course is 3 months in a regular class, but we can compress it also in a month, or even in less than a week if a group is formed and the students are willing to study all of these topics in a short period of time, specifically if they are from a medical background, they have a previous knowledge related to these topics, then a specific short course can be designed according to their needs, and inshallah we will cover these topics in a shorter period of time. So this was an introduction and the orientation class of our basic hijama course. I hope that you have enjoyed it, and inshallah you will benefit from this course a lot. Inshallah you will be able to perform hijama afterwards and in a better way, maybe in the best way possible, and that will be beneficial for you and for your patients both. So stay blessed and thank you very much. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.